This is the Plant Powered Challenge 2022, brought to you by Spectrum Health's Lifestyle Medicine team.
Hello, and thanks for joining us today. I'm Leon Hendricks. Today's session, the power of plants in preventing, managing, and reversing heart disease. We'll be talking with Dr. Thomas Boyden. He's a non-invasive cardiologist and a board-certified internal medicine doctor. He completed his internal medicine residency and cardiovascular medicine fellowship at the University of Michigan in Ann Arbor. Dr. Boyden's clinical interests include primary and secondary prevention of cardiovascular disease. Dr. Boyden, thanks so much for joining us to talk a little bit more about the Plant Powered Challenge and how leading a plant-powered lifestyle can impact the heart and heart disease. First, I'd like to, if you're okay with it, start a little bit with your personal story, professionally at least. We understand that you started in internal medicine, made the transition to cardiology. I'm curious as to what drove that change.
Well, I think when you go through your medical training, you have exposure to a lot of different things. And one of the things I always appreciated about cardiovascular disease is that it wasn't necessarily a terminal condition per se. People develop heart disease, but what I learned through all my training was that there's a potential to reverse this disease. And that's what really got me intrigued by it, because it wasn't necessarily to me a chronic disease state that I would be treating with patients for the rest of their lives. But if I could convince them of certain things that they might be able to do differently in their day-to-day life, we might be able to really reverse the consequences of the disease they had already developed.
Dr. Boyden, do you see heart disease as something that's always preventable?
Well, the data would suggest that 80% of disease, particularly heart disease, is preventable. There's lots of different ways of looking at heart disease. And what I'm really talking about is coronary artery disease, the plaques that build up in the arteries of the heart. And most of the governing bodies for heart associations around the world, including the American Heart Association, World Health Organization, European Society of Cardiology, we all recognize that there's many things that can prevent plaque from occurring in the arteries of the heart or throughout the body. But most of that is down to an individual. And a lot of the work we're doing to help patients is managing risk or managing symptoms of disease that has developed.
What are the commonalities that you see among your patients? Obviously, I know all patients are different, but are there some recurring themes that you see your patients suffering from?
Most definitely. I think what we typically see is people who are kind of following the typical pattern we're seeing here in the United States, where they're not very active, they're not eating very healthy. This is affecting their weight, and that those conditions of not eating healthy, not being active, and having excess weight are changing the metabolic dynamics of their bodies. And it's creating inflammation, it's creating insulin resistance, it's causing high blood pressure, it's changing the cholesterol levels and triglyceride levels in the body. And all of those things are really contributing to the risk of not only cardiovascular disease, but events like heart attack and stroke.
What excites you about the work that you do and the outcomes you're able to bring to your patients?
Like I was talking about earlier, I really love the idea of being able to reverse chronic conditions. I think we all go into healthcare to help people. We're taught a lot about pathology in med school and how to treat that through not only med school, but our residency programs. But really, I think most of what we do in terms of treatment for chronic conditions is really managing symptoms, risks, and potential adverse events from these chronic conditions. What I really appreciate about the work I'm trying to do with my patients is really convince them that their day-to-day habits have such a profound impact on their health that they can potentially reverse diseases like coronary artery disease, like diabetes, like high blood pressure, like high cholesterol. And if they can change those things about themselves, they are going to live very healthy lives. They're going to feel good. They're going to have a better quality of life. And I think that's more than anything what we're all looking for. It's really hard to understand how long any of us will live. And I think we're all looking to live happier, healthier lives. And I think the key to that is our day-to-day habits.
Can you give us one of your favorite success stories, a real change that you've been able to see one of your patients make in their lives?
Absolutely. I have several, and most of them are patients who have really severe coronary artery disease. So they have had multiple interventions on the arteries of their hearts, whether it's stents, whether it's bypass surgery, whether it's a combination of those things. And they haven't just been through it one time, they've been through it multiple times. And the traditional ways we try to go about managing the risk, whether it's with some of these medications, such as statin medications or blood pressure medications, sometimes people just can't tolerate these medications. They have so many side effects from them that their lives are so miserable due to the side effects that they would rather live with the increased risk of not taking the medications than live with the side effects from taking them. And what we really do through our preventive cardiology group is try to get people to understand that their dietary habits, their activity, their management of stress, their sleep, all has such a profound impact on their health that they can potentially reverse disease. I've had an individual who saw me out of the Howland area who had been through bypass once, stents multiple times, had a couple of different occasions where he had a heart attack, and he just could not tolerate any medications and was just looking for any answer, any solution that he could find. We introduced him to the concept of plant-based eating to reverse heart disease. And this requires a lot of discipline. It's something that I don't think is for everybody. And certainly I've introduced it to more people who have said they wouldn't do it than I have introduced it to people who actually have embraced it. But really, if you are an all plant eater, whole food, all plant eater, and you're minimizing oils and fats in the diet, we know through clinical research that you can reverse plaque. And not only did this individual's kind of quality of life improve, we saw dramatic improvements in all of those things that we measure that put people at risk of cardiovascular disease. For instance, his LDL dropped from over 100 to less than 40 just by change in diet. His blood pressure normalized and he was taken off blood pressure medications. He was borderline diabetic, and that completely reversed with normal blood sugars. He was able to lose about 35 pounds with this diet, and he's never been happier. You know, he is a total champion of this way of eating, and he talks about it with others. He's spoken for us, 2 groups of patients on our behalf, and I couldn't be happier for him. And that's really the goal of our program.
What was his reaction like when he started seeing those improvements?
I think he and his wife were just floored by it. You know, she obviously is on this journey with him, and did it to support him, not because she was trying to reverse heart disease in herself. But I think, you know, they were in their 60s. They didn't think these types of changes were even possible. And I can tell you, they both feel so well and so good from it, that they're just astounded. You know, every time I see them, they are still singing the praises of it and so happy that they were introduced to the concept. And that's really what my job is, to introduce people, to get them to understand how things can change. But I can't make those changes for them. I can do what we do traditionally, which is prescribe medications to help control risk. You know, if they develop symptoms, get them to the cath lab to see if there's something we can change about the blood flow that changes symptoms. But the real change occurs at home on the day-to-day basis.
You know, I'm sure a lot of folks will look at this plant power challenge or the idea of leading a plant powered lifestyle and say, you know, aren't we carnivores? Aren't we designed to eat meat? And if we don't, are we missing out on something important?
You know, I have that conversation with people all the time. And aside from potential decrease in B12 from not eating animal products, there's almost no downside to this. And all of the research shows that the more plant forward our diet is, and I say plant forward because there's lots of different ways of looking at diet, but we don't need meat for protein. And I give the example of multiple professional athletes who have completely embraced the whole food plant-based diet as their nutrition with no animal product in it, and they can compete at the highest level of physical fitness that we do as humans. And if people can do that, then how come we can't do that on a day-to-day basis is what I would ask. We know we can do it. We know it's incredibly healthy. We know it not only changes our risk of cardiovascular disease, but it lowers our risk of cancer. It changes our blood glucose. It lowers our blood pressure. It decreases our risk of Alzheimer's disease and vascular dementia. It improves kidney function, health. It decreases inflammation. There's zero downside to this way of eating.
What do you say to patients, and I imagine this comes up also, that say, I can't go all in on this, but I'd like to adapt my lifestyle to some degree. Are there, if the patient wants to have some kind of meat, are there ones that you suggest that are more healthy?
Yeah, so when I talk about plant-forward diets, you don't have to be necessarily an all-plant diet eater to derive health benefits. If you look at things like the Mediterranean diet, which is predominantly plant-based and whole food plant-based, but it still allows a little bit of animal nutrition, including seafood, fermented dairy, and very little land-based animal. There are almost immediate health benefits compared to the standard American diet, which is, depending on the source you're looking at, 50 to 65% processed foods, 25 to 40% animal-based foods, land-based animal foods, and almost no whole food plant-based foods. So, when you start making these subtle changes to the diet, you start getting rid of processed foods, eating more plants, reducing how much animal you're eating, you derive health benefits almost within a couple of weeks. When we do medication trials, it often takes a year or more to see cardiovascular risk change because of medications. And if you can make that change based on your diet, there's no reason to continue doing some of the stuff that we are doing to ourselves. And so I use the Mediterranean diet as an example because it's been well studied. It was run in a clinical trial the same way we run medication trials. And the health benefits were absolutely outstanding. And so I ask people to take baby steps. Think about some of these processed foods that you could eliminate from the diet. Start adding more plant-based foods that you like. Start witnessing and recognizing the benefits you're getting from this, whether it's how you feel, whether it's your blood pressure dropping, your blood glucose improving, your weight decreasing, your improvement in sleep, or your energy levels. And as you can start to appreciate these things, continue to take baby steps to introduce more plants to the diet and start eliminating more of the animal products from the diet. And I think most people who kind of take this approach have had a lot of success. I think it's hard to change habits overnight, particularly ones that might have been around for, decades, 50, 60 years even. So I'm not expecting people to make changes overnight, but I always want to remind them that those little changes that they make on a day-to-day basis have huge impact in their health.
We talk about heart disease. It is the leading cause of death on the planet. Some 14 million people are dying of this each year. I'm curious as to why you think this problem persists. The science behind what causes it isn't entirely new, but it still continues to kill people in droves.
Yeah. I think, that's a very complex question that has a lot of different potential answers to it. But I would tell you the trend around the world, and we see this through nutritional research, is that we are, as a world, relying more on processed foods, less on foods that are literally growing out of the ground. We're decreasing the amount of farming space. We're increasing the amount of farmed animals, if you will, where we're keeping animals kind of not allowing them to graze naturally, but keeping them more locked up and penned for food production purposes. But we're also seeing people's lifestyles become more sedentary. very possibly because of the explosion of technology throughout the world. We're also seeing things change because of environmental changes to the world, pollution around the world. But I think one of the biggest drivers that we see, and we see this particularly here in our own country, is that our day-to-day habits are very poor. The national, there's a survey that comes out called NHANES. It's about our nutrition in particular, and it comes out every few years. And it really takes a look at how we are doing from a health and nutrition perspective. What it really tells us is that less than 3% of our country is following a healthy diet, maintaining a healthy weight, getting an appropriate amount of physical activity, and I'm not saying exercise, I'm just saying physical activity, and doesn't smoke. So to be able to claim all four of those things, that's less than 3% of our society. And I think if you understand that fact alone, you can understand why cardiovascular disease is still the #1 killer in our country and around the world, despite all of our medical advances in treatments, not only pharmacological, but interventional, surgical and non-surgical interventions.
And Dr. Boyden, you've said that you lead a plant-based lifestyle. I'm curious what challenges there are for you, or do you get to the point where it's easy and you're not tempted by the donut shop or the steakhouse anymore?
It's funny. I'm not tempted by the donut shop or the steakhouse. And I will tell you, when I went through this started during my medical training as a cardiology fellow. I had already learned a lot about cardiovascular disease through my residency. But as I was getting more into my fellowship and trying to figure out what I really wanted to do, I had originally come in thinking I was going to be an interventional cardiologist and spend my life in the cath lab and stenting and or diagnosing disease that we see through angiography in the cath lab. But the more I learned about that, and the more I learned that I was really managing symptoms and not really altering the course of somebody's health, that's when I really started to challenge myself to say, hey, if I'm going to talk to people about improving their lifestyle, I have to do that for myself. So more than 15 years ago, I embraced this, and I would tell you, I felt instantaneous benefits from changing my diet. I felt healthier. I slept better. I had less daily aches and pains. And I still feel that way. And, I use myself as an example, and I want to walk the walk so that I'm just not telling people what they should do, but I'm also practicing it. And I will tell you, I've never been happier that I have done it. I will tell you, having 2 teenage kids definitely challenges your ability to follow a plant-based diet on a day-to-day basis. But I know, my children have really kind of embraced a lot of the ways we are preparing foods for our family. And I think the more you do that for yourself and your family, the easier that becomes for everyone in your family.
How long would you say it took you before you felt like you were at that point where you weren't craving and tempted and all of the other struggles that people go through while trying to make this transition?
I think it takes, I think for some people, for myself, it probably took a couple of years. And I will tell you, when I really made this change, dairy was the hardest thing for me to give up. I really like cheese, and so it's something that was harder to give up than meat per se. I think it's different for everybody, and I think for some, the length of your habits becomes somewhat of a hurdle. Sometimes it's not your own personal hurdle. Sometimes it's the family hurdles that you may want to embrace these changes, but others in the family do not, and it becomes a challenge to be preparing multiple different meals for the family on a day-to-day basis. So sometimes those hurdles are not personal. Sometimes they're more a family dynamic. But I've seen people embrace this immediately. I've seen people say, I don't think I can do this. And then unfortunately are suffering from another consequence of their habits before it actually really sinks into them that, hey, maybe I really do need to make some changes. But I never know for each individual, but I always think it's worth walking them through how they can make those changes. And this isn't just about me. You know, we have a team, a nutritionist, a psychologist, a group of exercise physiologists, all of whom help our patients understand the benefits, answer their questions, help them meet their challenges head on. And it's not just our group. I know Lifestyle Medicine is doing this. We're doing this over at Women's Health. Our nutrition program, our dietitians and nutritionists here in the Spectrum Health System are embracing this more and more. And I think we're seeing a really widespread use of this throughout medicine, because it's not just about cardiovascular disease. As I mentioned before, we can really impact so many different chronic conditions, including immunologic conditions, neurologic conditions, cancer, cardiovascular health, diabetes, hypertension, et cetera. So all of these things benefit from the smallest changes that we can make on a day-to-day basis.
For you, was it a phased approach into going into this lifestyle, or did you go at it cold turkey, or I guess I should say cold tofu?
Yeah. I never embraced cold tofu, I don't think, but yes, it was definitely a process. I think one of the first things I did was try to give up red meat, which we know has slightly worse health benefits to us than other types of meat. Processed foods were next on my list, because it's really hard to avoid processed foods. We've become so reliant on them as a country, and that's becoming more ubiquitous throughout the world. And so trying to find healthy, natural foods that aren't processed was a challenge when I started this 15 years ago. I will tell you, though, that's becoming less and less of a challenge as you look around. You just have to look a little bit more, and you can find these foods very, very easily. So I'm happy to see that we are embracing this more as a society. I'm actually very happy to see that younger generations are really not only recognizing this, but practicing this as a way of life, because I think, you know, the burden of chronic medical conditions is having such a major impact on our health as a country, our economic health as a country, that we've got to make some changes. And I think these younger generations are going to help us in the long term because of some of the habits they've developed at a young age.
Mm-hmm. When you look at this, I'm curious if there's one thing, like if you said, if I could get all of my patients to X, it would make a huge difference. What would that thing be, if you can think of something?
So, you know, I think dietary habits are things that are very hard to change. The one thing I practiced or preach to my patients is that I always want them to focus on eating more plants, eating less animal, and trying to eliminate processed foods when it comes to dietary habits. That's kind of my mantra. How they do that, I really leave up to them, because everybody's an individual. Everybody thinks about this a little bit differently. Everybody likes different things and has dislikes that are different from others. And then the other thing I really want to get across to people is that the smallest amount of physical activity, like a 30-minute walk per day, can have just as equal and impactful health benefits as these changes to the diet. We know that 30 minutes of walking a day reduces cancer risk, dementia risk, it improves neurologic conditions, neuropathies, it improves our immune system, it reduces inflammation, it improves blood pressure, reduces blood glucose, reduces blood fats like triglycerides and bad cholesterol like LDL. It helps change body composition so that you're decreasing your percent body fat, increasing your lean muscle mass. And when you do that, your body processes its energy sources, which are glucose, fat, and protein. It changes how the body processes those things to a much more healthy way of utilization. So my big push to patients is just do the small changes. Take the 30-minute walk or the equivalent thereof every day. Start thinking about things that you can eliminate from the diet and things that you can introduce to the diet that you know are more beneficial to you, and you will see benefits right away.
one of the curveballs in all this is things that are marketed to us as healthy that we then learn are not healthy.
Yeah,
I'm thinking like, like the impossible meats that we hear
yeah,
talked about, or those meat substitutes, protein drinks, and things like that.
yeah.
What's your take on some of um, those health, those items that are billed as healthy?
Yeah, I'm glad you asked that question, and I'm glad you used that example, the impossible meats. They're impossible. They're called impossible for a reason. They just really aren't healthy. Um, you know, in general, all of these foods that you just mentioned and all of these supplements that are being touted and advertised, they're processed foods. And I want to get that across to everybody that processed foods don't really have great health benefits to us. All of these vitamins and minerals that these processed foods are claiming to have in them can all be found through whole natural foods. And if we're eating whole natural foods, we're getting all of those nutrients and micronutrients, vitamins and minerals that our bodies need, not only for their day-to-day metabolic processes, but for healing processes and eliminating inflammation within the body. Processed foods do not do that. They increase inflammation. They have preservatives in them that we don't know exactly what are doing to us, but likely are increasing our risks of other conditions such as cancer. So we have to be very cautious about processed foods. These processed foods don't go through rigorous scientific research the way some of the other things we're recommending in medicine do. And so claims can be made about those things that don't have to go through a rigorous process. And so I think if we really just think about foods as they grow from the ground, eating them the way they grew from the ground, not processed into something else, and eating very little animal that hasn't been processed in other ways, I think we're kind of on the path to not only recovery from what we've already done, but improving our health long-term moving forward.
Mhm. I want to talk a little bit about genetics. I'm sure there are folks who, because of their family history, and sometimes it's both mom and dad's side, feel like, well, heart disease is a foregone conclusion for me. Is that ever true?
So I kind of look at genetics, particularly when there's real genetics involved. When there's things such as like familial hypercholesterolemia, elevated lipoprotein A, things along those lines where you really don't have control over those conditions based on your lifestyle. So for things like that, I think we have to be more aggressive about what we do from a medication perspective, how we help treat these medical conditions. But I look at genetics as, potentially the fire, but your day-to-day habits as the fuel that can make this from a very, small little campfire to maybe like a forest fire very quickly. So genetics, for the most part, doesn't play a major role in people's health. You can have heart disease on both sides of the family or one side of the family, but if you don't have specific genetic conditions involved in those, and the people in the family had similar poor lifestyle habits, that's probably the main reason why they developed these conditions. And so if you can get the person in front of you, your patient, your friend, your family member, to change their habits so that they're not similar to the other family members' habits, then I think you have a real opportunity to show that this isn't a family condition. This was a lifestyle condition.
So you're saying you think that we often mistake things that are really behavioral with genetics.
Absolutely, absolutely. When you look at our risk calculators for heart disease and cardiovascular disease, your family history is not even included in those risk calculators.
Hmm.
And when you think about 80% of heart disease being preventable, that I think tells you that most heart disease is not genetically mediated, because if it was, we wouldn't really be able to prevent 80% of it. We would be kind of victims of our genetics.
Are there specific foods that you would recommend that particularly help your heart?
In general, like we've been talking kind of throughout this, it's really about being a plant-forward eater. So I don't have a specific food that I'm going to tell patients, hey, you definitely have to eat this. But what I want to get across is the more whole food, plant-based foods you're eating, the better off you are. Not only because they improve the function of our blood vessels, they help clear plaques from our blood vessels, they help reduce inflammation, but they can restore health to the other systems in our body in such a way that you get these huge health benefits by just eating more plants in the diet. People talk about proteins, and we talked on this a little bit earlier. Well, I'm not going to be able to get protein. Plants are packed with protein, leafy green vegetables, nuts and seeds. Mushrooms are a wonderful source of protein. Legumes, beans and legumes are an amazing source of protein. And there's lots of whole grains that are also excellent sources of protein. So all of those foods are out there for us to have. All of those things are there for our nutritional needs. We just have to start making these changes and realizing the benefits.
We're an impatient people here in the United States. And so a lot of folks kind of want that instant gratification, but changes like this take time for us to realize. I'm curious, in your personal experience and in the experiences that you've seen with your patients, how long does it take to make a real difference with these kind of changes?
I think you have to try to target what would make the difference for the individual, because as I've talked about, you can change so many different parameters of health through changes in diet and physical activity that you have to kind of work with an individual on what they want to accomplish. For some, it might be getting their blood glucose down. For others, it might be improving blood pressure. For others, it's improving weight. And what I try to do is figure out what's the most important thing to the individual. I explain to them how these dietary and physical activity changes impact that particular goal. And then we work on that in the short term. And we often see, changes as quickly as a couple of weeks to a couple of months. And I think once you start realizing these gains about what a particular individual's specific goal is, it becomes much easier to sustain because you've realized that impact right away. And like you said, people are impatient. So if you can show them improvement quickly, they're much more likely to stick with this.
Dr. Boyden, let's talk about cost. Quite frankly, food that's less healthy is also less expensive to purchase at the grocery store. How do you get your patients around that?
So I think there's many ways to look at this, and I think a lot of the fear of being more of a plant-based eater does revolve around cost. And a lot of people's experiences, hey, I bought all these fruits and vegetables that I didn't eat right away, and they rotted, and so I wasted all that money. I always tell people, if you're going to start embracing this kind of change to your diet, you kind of also have to change your habits with regards to how you shop. The one thing I noticed when I made these changes was that I or my wife, we go to the store multiple times per week. We're not there like once doing a big shop and then we're done for the week to 2 weeks. We literally are at the grocery store probably 2 or 3 times a week, and we buy small amounts of food that we're going to use within a couple of days. I think that's the biggest change that I've noticed. And I think when you look at the research on this, that would really be supported as well. And I think, in general, you might initially say, oh, this looks expensive. But when you start looking at the cost of meats and you start looking at some of the things that your lifestyle is doing with regards to your health and the need for medications, medical tests, medical procedures, those can far outweigh any cost differences between these ways of eating. Yes, processed foods can sit on your shelf or in your fridge for a really long time. But I think that should tell you something about whether or not it should be in your body, because if it can last that long on a shelf or in a fridge, maybe that's not something that you want in your body being processed and used in your body. And a lot of the research done on these plant-based diets doesn't show major differences in terms of cost between the standard American diet. I think you just have to really look at the time spent doing your shopping. Because I think you are going to spend more time going to a grocery store when you embrace this. And, as winter hits here and we don't have availability of fresh foods per se, one of the nice things about freezing vegetables and fruits and plant-based foods is that they essentially maintain all of their nutrients. And so I always tell people it's a little bit less expensive to buy frozen foods, frozen fruits and vegetables, particularly in the winter. And so don't hesitate to do that, because they really do have all of those nutrients preserved through the freezing process. So yeah, I think the cost of medications, the cost of medical tests, medical procedures, and the consequences of unhealthy habits and how it makes you feel and what it does to your overall health far outweighs any change in the cost of the food.
All right. Dr. Thomas Boyden, thank you so much for your time and your insight, and helping those who are interested in changing their lifestyle do so with the steps you provided. Thank you very much.
Thank you. I really appreciate the opportunity to speak with you.